Good morning. Joined by Dr Veach and State Health Commander Catherine Morgan-Wicks. As I've said many times, our number one priority is the health and safety of Tasmanians, and that remains the case as we work through these matters in front of us regarding transition. Now, it's now been 4 days since our borders opened, and my advice is that compliance continues to be very high, with very few cautions being handed out to people entering the state. In fact, yesterday, with more than or around 6,500 people entering the state, there were only 3 people that attempted to enter, 2 unvaccinated, 1 without a pass at all. All 3 were returned or left the state, whether they returned back to their home port or not, but they left the state. 2 of them were fined and received an infringement notice for $1,557. But very strong compliance at the borders. And I do want to thank those people that are coming from interstate and Tasmanians that are returning for doing the right thing. It's important that we do. Now, I want to provide a quick update on the 3 new cases that were announced this morning. This brings the total number of active cases in Tasmania to 7. 1 is a family member of a previous case. That person has been in quarantine as a close contact and poses no risk to the community. The second case is an international traveller who entered home quarantine when they arrived in the state and has not been in the community and remains in isolation. The other positive case arrived in Launceston on Wednesday and was in a number of venues, retail venues mainly, across the last 3 days. Those venues are all listed on the coronavirus website, and I'd advise people to go and have a look at the coronavirus website, check those exposure sites. But I would make the point there is no need to isolate if you're a casual contact, but have a test if symptoms develop, and importantly have a test on day 3 to 5, and you must continue to socially distance. But for those exposure sites, and a number of them, JB Hi-Fi, others that have been listed, it's only if you were there in that handful of minutes, in many cases, that the person was there. So if you've been there in the last couple of days, don't think that you need to rush out and get a test. You are not a casual contact if you weren't there at that precise time. Now, importantly, if you're a close contact and you're vaccinated, you must quarantine for 7 days and have a test immediately at day 5 and 6. And if the tests are negative, you can re-enter the community. Then continue to monitor for symptoms. If unvaccinated and a close contact, you'll need to quarantine for 14 days and have 3 tests whilst in quarantine. Now, Public Health has contact tracing underway and are advising people if they are a close or casual contact. But I do ask for people, as I've indicated, to continue to check the website. The exposure sites are listed. Make sure that you contact Public Health if you need advice. I know that there is a flurry of activity in Launceston at the moment in terms of testing, but check the website. If you weren't there at those sites at the times that are listed and you're a casual contact, you don't need to get tested unless you have symptoms, obviously. Now, importantly, what we're seeing occur at the moment is not unexpected. We said that we would see COVID in the state. That's what's occurring. We have strong measures in place, and we're continuing to track and trace and obviously keep the public informed. The most important thing, obviously, that we can do is to ensure we keep our vaccination rates high, and I'll speak more about that in a moment. I do, though, want to talk about the subject of masks. We raised on Friday that Public Health has been actively considering whether to implement a mandate for mask wearing to further reduce the spread of COVID-19. I think it's important that we take these extra steps to ensure that we keep our communities safe. So I can advise today that effective from midnight on Monday, that'll be the 20th, or 12:01, which will be the 21st of December, midnight Monday, masks will be mandatory for all indoor settings. So that will include offices, restaurants, pubs, clubs, also including public transport or in taxis or ride sharing, retail settings, supermarkets. We've done this before. It's important. In fact, a lot of Tasmanians are already doing it, as is everyone in this room pretty much at the moment, unless you need to remove your mask to communicate. And Now, in terms of the mandate, in terms of masks, a strong recommendation that from today that you start wearing your mask indoors, but it won't be mandated until Monday night, and importantly, I'd encourage everybody to fall into line with this, do the right thing, and let's keep our community safe as we move forward. I'll just touch on gyms because I'm sure there'll be a question on it. In terms of gyms, yes, you will need to wear a mask, but if you're partaking in vigorous activity, take it off. Likewise, if you're going for a run, well, in fact, you won't, if that's indoors on a treadmill, take it off. That's sensible. Just use your common sense in terms of this as we move forward. Now, regarding vaccination, I want to, as I've said, remind people that the best protection you can have and provide others is vaccination. As of Saturday, 96.84%, so nearly 97% of Tasmanians aged 16 and over have had one dose of the vaccination, and 91.56% are fully vaccinated. For people aged 12 and over, 95.73%, so we're closing in on 96%, have had one dose of the vaccination, and importantly 90.22% are now fully vaccinated. The success of our vaccination program has enabled us to get to where we are today, where we can reopen. Importantly, if you're due a second jab, please go and get it. Now, I want to just chat about boosters. Obviously, the 6-month period has been brought forward to 5 months. If you are due, make sure that you book in to get your booster. There are spots available. I was due yesterday and booked in during the week. I went and joined thousands of other Tasmanians, and I understand more than 2,000 people yesterday had their booster shot, along with myself as well. Clinics will remain largely open over the Christmas and New Year period, so make sure that you book if you are due your booster. Catherine Morgan-Wicks will talk more about boosters and testing in a moment, but I can say that yesterday our testing clinics across the state had around 1,400 people that attended for a test. So in closing, continue to do the little things. Make certain that you socially distance. Make certain, and as I've said, it's recommended that from today start wearing a mask if you're indoors, but from Monday midnight there will be a mandate for mask wearing if you're indoors or on public transport. Continue to do those things. Sure, if you can't socially distance, that you manage yourself in terms of wearing a mask. Let's halt the transmission of this and make certain that we can return our lives to a more normal way of going about our living as quickly as possible. I'll hand over to Dr. Bird.
Thank you, Premier, and good morning. So I'll just provide first a little bit more detail on the most recent cases. You'll know that in the early days after opening up, we had 3 young adults diagnosed with links to Newcastle. The laboratory results have come back and show that each of those cases was, as we suspected, due to the Omicron variant, and all those people had been managed with that expectation in mind. The results of the testing on the remaining 4 cases will be done will come through early in the week. They'll be done as a batch by the laboratory early in the week. So there were the 3 adults with the Newcastle links. They're all doing well, as is a young adult who was diagnosed a day or so later with links to Sydney. The 3 cases, as the Premier mentioned, were a person who was a family member of a previous case who was in quarantine and so generated no new public exposure sites. The other was a person who arrived from Europe via Melbourne who went into quarantine. There are some people on the plane with that person who were declared casual contacts or close contacts, depending on how close they were to the case on the plane. And the final case, which generated quite a number of exposure sites in the Launceston area, was a person who arrived in Launceston from Sydney on Wednesday and got tested when they became symptomatic. So they acted responsibly in ensuring that there was relatively little time that they were spending in the community infectious. And we've conducted contact tracing for all of those cases so far. The Premier made a very important point. in what the requirements are of people who are casual contacts. Now, close contacts, and in total we have around about 100 close contacts associated with the 7 cases to date. Many of those are people on the planes that those people flew in, and those close contacts are required to quarantine in their home if it's a suitable place, or otherwise in a hotel. I think the majority are currently at home, but there are a number in hotel quarantine. Those people will have 2 tests before they're allowed to leave, providing they've been vaccinated, but if they haven't been vaccinated, they will generally need to quarantine for 14 days. Casual contacts are much more numerous, and there are many hundreds of casual contacts associated with these cases. And they will generally get contacted by an SMS message that tells them of a requirement to get tested on day 3 through 5, no sooner than day 3, no later than day 5 after their exposure to the case. There are many more of those people, and the SMS message, people may read, as the Premier noted, that JB Hi-Fi or a certain another retail outlet was listed as a casual contact site. It's really important that people look at the particular minutes of the day that the person was there. If you were there at the same time as the case, and it may be only several minutes, it may be half an hour, the time frame, they're the people who are there at that time who are casual contacts and need to go and get their test between day 3 and day 5, and to wear a mask for 2 weeks if they can't manage good social distancing. If you went to one of these premises at another time on the day that's not listed, or on another day, you're not a casual contact, and you don't need to get tested. Like everyone, you need to be vigilant for symptoms, but we're not requiring people who are at these casual contact sites outside of the specified times to get tested. I think that's an important message for people to understand. Just say a few words about masks, and we've been thinking about this for some weeks as a potential intervention to add protection to the Tasmanian community. I think I said the other day that when we were thinking that we were going to have Delta as our predominant strain in Tasmania, we were in a position to just perhaps pause on putting masks, pause on a mask mandate until we started to see community transmission. But I think that Omicron has demonstrated such an ability to spread, and even in vaccinated populations, that we need to pull out this measure now to try and get ahead of the community spread of Omicron in the Tasmanian community. And that's why a mask requirement will apply to all non-domestic indoor settings from a minute past midnight on Monday into Tuesday morning. So effectively it's when you're not in your home or another person's home and you're not outdoors. So it'll apply to retail, hospitality, offices, public transport, and also to existing places such as hospitals, residential aged care facilities, and outdoor events of more than 1,000 people where there's already an existing requirement. There will be some exemptions. It will apply to people aged 12 years and older, but if parents have children who are under 12 and might like to wear a mask because it makes them look like they're older than 12, then it's fine for parents to have their younger children wearing masks if they tolerate it as well. There's medical exemptions from mask wearing, and there's exceptions for people to remove the masks to communicate clearly, to eat and drink and so on. So fairly similar arrangements to what we put in place for the short 3-day lockdown, but the difference with that one is that we're not requiring people to wear masks routinely outdoors, although I see many will. It's a minimally intrusive measure that aims to help us keep other settings roughly where they are. It's cheap, and it really has been widely used and accepted around the world. And we have evidence of benefit from the Australian experience and from modelling which suggests significant benefits in the face of a highly transmissible strain. So it's something that we can all do to protect ourselves and to protect Tasmania.
Can I just quickly double check, does the mask mandate come into effect Tuesday morning or from Monday morning?
Tuesday morning, when you come to work on Tuesday, bring your mask. But as the Premier noted, we'd really encourage people to get into masks indoors from now, as many people are.
Is this something that people, Tasmanians, can expect to have in place for months?
I would expect that it could probably be in place for a couple of months. We really do need to see how the Omicron epidemic plays out. We're going to be really busy in the next couple of months doing things such as boosting people and initiating vaccination programs in children. We'll also be mixing and moving quite a lot over Christmas. There's an upside and a downside to that. We tend to spend less time in businesses and offices and retail if we're taking advantage of holiday breaks, but we may spend more time actually in other sort of elective settings and hospitality and at home. And I mentioned last week the importance of thinking about your home gatherings when you're gathering over summer. There's no intent to reach into people's homes to put masks on people, but I expect that many people will, particularly if they're bringing older and vulnerable family members around, may consider running the events that they're having in their homes perhaps as smaller events, maybe have a couple of smaller events rather than one big event. Do it outdoors, spread people out in the backyard, and even think about whether some family members might choose to wear masks as a special occasion. We wear those ridiculous Christmas party hats you get out of the bonbons. I can't see why we wouldn't wear masks.
Are you concerned about what's happening in New South Wales? We're seeing a lot of cases coming out of New South Wales, but also restrictions easing, including rules around check-ins have been relaxed. Is that a concern for you here in Tasmania?
I think I have to respect the decisions of the New South Wales decision makers and not enter overtly into that discussion. I'm sure you'll understand that. In Tasmania, we have maintained a lot of settings, and if people see New South Wales and worry Tasmania is necessarily going down the same path, we haven't dropped lots of settings. We have maintained density limits across the epidemic, and we still have them in place by being cautious. We're maintaining number caps on indoor, outdoor and domestic settings. We're requiring people who are running even relatively small events to have COVID safety plans. We're requiring people to have check-in TAS, and we're putting people into masks. And I think in our fortunate situation of not having high-level epidemic spread, as New South Wales unfortunately is, that we've got a good suite of measures in place to try and reduce the likelihood that we quickly go down that pathway. The decisions on how New South Wales will manage their circumstances is for them.
What would need to happen for us to ease these restrictions?
To
ease these restrictions?
I think the most important thing is time, actually, that we see how that the epidemic progresses over the next 4 to 6 weeks. And if it proceeds well, then we might look to some time beyond that when it may be possible to remove some restrictions. We will also be, as I said, going pretty hard at boosting people and then rolling out the childhood vaccination. So I think we just need to be cautious for a little while. We don't want to. I would not be advising the government to pull back on measures anytime very soon.
Some of our border measures were set to be reconsidered after about a month, I think it was. Is that time likely going to extend given the current circumstances?
The management of the border measures is with the Deputy State Controller, and they will determine the timing of reviews and changes. They obviously take input from Public Health and a whole lot of other agencies, so I don't think I'd want to preempt that decision making. But we track what's going on and the effectiveness of our border measures all the while. So, last week on, I think, Tuesday night, I recommended we declare, Tuesday or Wednesday, we declared Newcastle a high-risk area, therefore requiring testing before entry to Tasmania if you're coming out of Newcastle. And then on Wednesday night, I recommended we do the same thing for all of Sydney, the coast up to Newcastle, and all of Victoria, all of Melbourne, including Geelong. So that was an adjustment to the border measures based on the emerging risk there, and we make those kind of assessments and adjustments along the way as we need to.
I'm not sure if you'll be able to you're across this situation, but the cabin was, a lot of people received text messages yesterday saying they were identified as being in the cabin yesterday, several days ago when the exposure site occurred. Then they subsequently received a text message about half an hour later saying it was a mistake, you weren't there. Do you know how many people were affected by those messages?
No. I mean, when we have to strike a balance. We have we identify places that our case tells us they went to, and that's where we start. Sometimes you have to go back a couple of times to get the timing right. It's really good if people are using check-in TAS, because that lets you actually determine at least when they entered a particular site. What we sometimes do is send out a message to everybody who was at a particular place on the one day, but draw their attention to the particular time that they need to be concerned about. So sometimes messages will go out a bit more broadly to people who are at a particular venue on a day, but it's important they pay attention to the message, because the actual action generally only needs to be taken by a small part of that whole group of people. So I'm not sure if that was the circumstances, but I'm sorry I wasn't part of that particular process.
Captain Morgan.
Good morning, everyone. I'm going to say a couple of things today around vax. I'll quickly cover COVID at home, but most importantly testing and check-in TAS exposure sites. So as of Friday, we have 96.8% of people aged 16 plus with at least one dose and 91.6% fully vaccinated. And for people aged 12 plus, 95.7% have had at least one dose and 90.2% are fully vaccinated. And we've had a super Saturday for boosters, with over 2,000 booster doses delivered yesterday. And this takes us to approximately 35,000 boosters delivered across Tasmania to date. And in less than 1 week, close to 7,000 5 to 11-year-olds have been booked in for January. But our focus in vaccination needs to remain on the 13,000 Tasmanians over 16 that have not yet vaccinated, the 23,000 that are still due a second dose for full protection, and the 6,000 children aged 12 to 15 that are yet to receive a single dose, and the 38,000 young children, so aged 5 to 11, that are still to book in for a dose in January. Now, we are adding hundreds and thousands of appointments, so please hop online and book a vaccination appointment or ring our public health hotline. Now, for COVID at home, the COVID at home program is now fully operational, and we have 6 of the 7 cases in the COVID at home program. The program provides a remote monitoring and online support program to deliver safe and effective care to our COVID positive individuals within their homes, with the backup of a dedicated 1800 number to reach health professionals 24/7. Now, the majority of our COVID cases, as I've mentioned, have been assessed as suitable for recovery at home, with 1 case recovering in a case management facility. And caring for individuals with COVID-19 in their homes allows for the provision of appropriate care and minimises the impact on our healthcare system and frees up hospital beds for patients with moderate or severe illness. If I can go to testing, widespread testing of people with cold and flu-like symptoms, even mild, is critical to track and slow the spread of COVID-19. And over the last 3 days, we have averaged over 1,000 tests per day, with the impact of contact testing and travel testing. Yesterday, we did close to 1,400 tests, as the Premier noted, with over 900 in Hobart, close to 300 in the north, and around 200 in the northwest. Now, we are experiencing a significant surge in demand for testing in Launceston, with close to 700 referrals this morning for a test in a state clinic and some long queues at the private pathology drive-up site and the state site. And this appears to be driven by the publication of exposure sites on Check-in TAS and our website. So it is critical, as the Premier and Mark Veitch mentioned, to check the times that have been identified that have been published, not just the date. So you can check your own history of when you have visited a particular location on Check-in Tas to check this. But we have extended the hours for testing at our Launceston State Clinic at Dowling Street to 8 p.m. tonight and have 4 lanes operating. And we'll continue to add capacity to the Launceston testing clinics as we monitor the referrals that are coming through and also the lines for testing. The private testing clinic in Launceston, so at Wellington Street, will also extend hours through to 2 p.m. this afternoon, and we'll make sure that people that are still in line are catered for and can be moved through to our state clinic at Dowling Street. We also have a third site, which is the respiratory clinic in Launceston, also in Wellington Street. They take tests in afternoons 7 days a week. So we have 3 sites in Launceston that are available for testing. We'll closely monitor. We have full capacity in our hotline, so the public health hotline. As the Premier noted, we're standing up our Technopark site and we'll work through all of the referrals. So if you need a test, we'll make sure that you can get a test in Launceston. So with the addition of private pathology drive-through testing sites in our main sites across the state, we have lifted our testing capacity. So for Tasmanians or for travellers that are experiencing any cold or flu-like symptoms, even mild, please arrange a test, noting that in our private pathology sites that they are drive up, they don't have bookings, but our state clinics do have a booking system which can be online by going to www.coronavirus.tas.gov.au or by ringing our public health hotline. And that means that you can be given a time for a test and you don't have to wait in your car for long hours waiting for that. So we'll continue to watch and monitor this sudden surge in demand this morning. So if I can go to Check-in Tas, and just to note that exposure location alerts are now available for Check-in Tas app users. And if one of your check-ins matches the date and time of an exposure location, you will receive a warning message on your home screen of Check-in Tas. You'll then be able to see the coloured identifiers in your check-in history page for the exposure site that you are at. And these alerts are in place to let you know if you've been identified as a close contact or a casual contact. But if you're a close contact, you'll also receive that direct contact from our public health team. You can also view a full list of all exposure sites in the state on your Check-in Tas app. So for all of us here today, we can check and see all of the exposure sites there. That does not mean that you are identified as a close or casual contact if you have not been there and checked in at the same time period as the particular positive COVID case. So it really does come down to checking your own Check-in Tas history. It gives you all of the times and the dates, and to just really work through that detail. And more information is available on our coronavirus.tas.gov.au page, as we do have limited space on a small app such as Check-in Tas with the full detail available on the website.
There's been a bit of emphasis on casual contacts not racing off to go and get tests. Is that to not overwhelm the system?
So casual contacts are requested to test between days 3 and 5 of a casual contact. So probably what we're emphasising today is making sure that you are a casual contact before racing off to get a test. If you had gone to JB Hi-Fi, for example, in 2 hours before or well after the time period, you are simply not a casual contact of the positive case. You know, positive cases are measuring, sometimes 12 minutes in a particular retail store, not the full opening hours of that store. And it really does emphasise the importance of people downloading Check-in Tas, and I say this also to all travellers that are entering Tasmania, please download the Check-in Tas app. You will actually have a full history then of where you are visiting in terms of locations, and that'll help to stop the panic when you see a particular site listed and you know that you have been there that day. So you can really narrow down the time. If you are a casual contact but know that you've been in that time, it is testing between days 3 and 5 following that exposure. And if you're waiting for a test, we'll make sure that you can get one, and we're mobilising capacity in Launceston.
And are you increasing the staff members, just to clarify, working on those testing sites as well?
Yes, so we have opened up to 4 lanes at our state clinic at Dowling Street, and we are extending our hours of operation up until 8 p.m. tonight, but we'll be monitoring that through the afternoon. Typically with testing we get a big morning surge, and we've experienced that in the first couple of hours this morning with the 700 referrals. That is starting to come off though, so we'll closely watch that. We can also send through another additional mobile testing bus to Launceston and pick a further location if it's needed. So we're watching the numbers of test requests coming through.
I imagine all those test requests are taking up a lot of time for the hotline. Do you know the average wait time at this stage?
So about half an hour ago, for example, the average wait time had come down to 23 minutes. But noting that you can book a test online, so you can just hop on, and it honestly takes 2 minutes to be able to fill in the details, and that referral will go through straight to our testing hub, the same as if you'd rung up, for example, and got an operator exactly at that time. So they're working through both the online referrals and the direct referrals from the public health hotline.
Questions for the Premier?
Thanks, Catherine.
Premier, are you concerned about the situation in New South Wales and what that might mean for Tasmania now that the borders are open? We're seeing a lot of cases in New South Wales and an easing of restrictions.
Look, I think the actions that we've taken in terms of strengthening our border approach last Tuesday and last Wednesday in terms of where New South Wales are at indicates that we're watching them very closely.
The mask mandate might be challenging for some Tasmanians heading into Christmas. What's your message to them?
Look, I'm aware that some people won't like it, but it is a small thing that you can do. It's cheap. It'll keep you and the people that you love safe, and important, it'll keep our community safe. So I would hope that in line with our recommendation today that you'd start wearing masks indoors from today, but from midnight on Monday night, 12:01 a.m. on Tuesday, it'll be mandated.
And will police be monitoring the situation in public as well?
Look, obviously, in terms of the work that we do within venues and other locations, but again, as with the way that we've managed this, Tasmanians have responded well to these sorts of directions, and police will take an educative approach.
There will be people in the community for whom it won't be easy for them to get masks, and I know that when we had the lockdown in Hobart previously, police were handing them out to homeless people, for example. Will there be support like that available again this time?
Look, again, tomorrow, before the mandate comes in, we'll be looking at all of the processes and any areas that we need to provide additional masks. Many businesses are already holding them in stock, and they are available widely across the state, both in pharmacies and in supermarkets. But where there are areas that we need to provide additional attention, we certainly will. Look, I just might come back to your point on New South Wales, and I'd make this point very clearly. I noted, Dr. Veach, made the point that he needs to allow those states to take their actions. Well, my view would be that I think they have taken their controls off a little earlier than what they should have. And I'd be encouraging them to look very closely at what occurs in coming days in terms of the spread of the disease there. We will obviously monitor it here, but that's a state with a growing level of community transmission, and I would urge them to keep a very close eye on that.
We're now a week out from Christmas. The Devonport community is still very much reeling from the tragic circumstances early this week. Can I ask if you've got any update on that situation and perhaps a message for that community heading into Christmas this week?
Look, I'll certainly provide a message to the community. It is a dreadful set of circumstances, in terms of those 5 children that have died. Like, our thoughts are obviously with the families and the community, and obviously with the 3 that remain in hospital. When we can provide an update, we will, but it'll be a particularly difficult and challenging time for that community.
Thanks, Bill.
Thank you.